Yes, it may seem a bit bold, but I am.
Welcome home, Cojourners. I'm glad you're here for another episode. I'm Dr. Thema, here to facilitate your journey back home to yourself. I'm a licensed psychologist, ordained minister, and sacred artist, and I am so glad that you are here for this journey. In addition to the Homecoming podcast, I encourage you to check out my books, Homecoming, Overcoming Fear and Trauma to Reclaim Your Whole Authentic Self, the Reclaim Yourself workbook, as well as the latest book, Matters of the Heart, Healing Your Relationship with Yourself and Those You Love. On today, we're going to talk about being in relationship with a trauma survivor, giving us some coping skills and a framework for being a partner, a romantic partner, being a spouse of someone who has survived trauma. And we'll start this week, as we do most weeks, with a reading. And today's reading is from the book We Birth Freedom at Dawn, Volume 1 by Jaya John. And this piece reads, Today's love poem for you. Look at you, battered and bruised, worried and weary, and yet, and still, you keep choosing beauty in all your forms and fragrance. You must be a flower, yes. You must be worthy of endless, sweet arrivals. Oh, so beautiful. Such a reminder that even with our scars and setbacks, with our challenges and wounds, that we are deserving of sweetness and of beautiful things. And so I want to share some important pointers and reminders for those of you who are in a relationship with a trauma survivor. And also I want to acknowledge that sometimes both of you may be trauma survivors. So you want to think about these tips for yourself, as well as the ways in which you relate to your partner. When we have a traumatic experience, it's an overwhelming experience that could have created feelings of hopelessness, helplessness, horror. It overwhelms our usual capacity to cope. It can disrupt your sense of yourself, make it difficult for you to regulate your emotions, make it challenging to build and maintain relationships with others. It disrupts our nervous system, and it is the response to an overwhelming stressor. And it also is the story that we have sometimes told ourselves or about relationships in general as a result of that violation. There are many different types of traumas, interpersonal traumas between two people or more people, can be child abuse. So there could have been physical abuse or sexual abuse. There is sexual assault, and that can be in childhood or adulthood. The person may be a survivor of intimate partner abuse, also known as domestic violence. They may have survived community violence, school shootings. They may also be a veteran, have experienced war as someone who was enlisted or affected by war as a civilian. There are other types of traumas, such as a medical trauma or a natural disaster, a car accident, a workplace accident. But the types of traumas that most can affect our relationships are the interpersonal traumas, because they were caused by another person. And so you can easily see how that would translate to affect the ways that we approach each other and respond to each other. And so as you're thinking about this topic, I want to invite us first to take breath And so if it aligns with you, if it's comfortable for you, you can place one hand on your heart, one hand on your belly. Inhale in through your nose and exhale out through your mouth. And again, at your own pace, inhaling in through the nose and exhaling out through the mouth. So the first thing I want to share in terms of a pointer when dating or being in relationship with a trauma survivor is the importance of building trust over time. It will be very important to know that patience is required for a trauma survivor to feel they can trust. And so allowing the healthy growth, the healthy development of friendship, healthy communication, such that trust is then developed. Past experiences with abuse and with betrayal or with abandonment can make one really brace themselves for more trauma to come. And so we want to be intentional about not fueling fears or insecurities, but being a safe and supportive environment, being consistent in our care. And with that consistency and patience, then trust can develop over time. It is also important to know, as a part of developing that trust, that it's important to be consistent in our communication. So you want to be honest and transparent. You want there to be alignment with what you say and your actions and your behaviors. And you want to be a great listener. So actively listening when people are sharing their needs, their fears, their concerns. And as we are actively listening, we also want to hold space for people to feel their feelings, as well as for us to feel our feelings and to be able to express them in a healthy way. So a strong connection is a connection where both people can be very honest with each other and to be able to express the things that they are feeling and thinking. And so we create that environment by being able to hear concerns without taking them to be an attack or without being defensive, and for us to also be able to communicate our concerns. It is important to know that when your partner is a trauma survivor, whether you are or not, that it will be necessary for there to be mutuality and reciprocity. And so just as you would like a safe environment for yourself, a safe environment is also important for your partner. So we want to be able to show up emotionally, show up with presence, show up in words, and show up in our consistent actions. And by doing that, it can ease a lot of the anxiety, a lot of the fears that your partner may have. It will also be important to be tuned in to boundary setting. Sometimes trauma survivors have developed a tendency toward people pleasing, so may not be used to setting up boundaries or having their boundaries honored. And so tuning into both the spoken boundaries and also paying attention by a person's body language, by their facial expressions, by their withdrawal, you will start to learn what are their boundaries and also what are their triggers. If you make an observation, we don't want to then make an assumption, but to have conversation about it, to be able to better understand the person, what their needs and concerns are, and also for you to be able to express yours in a nurturing way and in a safe way. And we can invite boundary setting from a partner who is not used to setting them. So if I observe that there is unmet need, or I observe a tension or a source of stress, then I can invite conversation about that and ask if there is something that is needed or that is desired or a concern that the person is holding that perhaps has not been expressed. So in a relationship, we are learning each other, and we want to be intentional about the care. It expresses a care, it expresses love, to desire to know the other person, even to know the things that they have not felt safe enough with other people and perhaps with you in expressing or communicating. So we help people to know that they can share a need or concern with us and that it will be heard. And again, so that it's not one-sided, we also express what our concerns and our needs are as well. So along with the trust and patience, communication, as well as boundary setting, we also want to encourage our partners to get support. So being a partner or a spouse is an important role and can be a nourishing and healing role, but it is not the same thing as being the person's therapist. And so to encourage your partner to consider getting counseling, getting therapy that can be more in depth and with a trained and licensed professional who has expertise in helping people to work through the various traumas they have faced. And so, we want to communicate our desire for people to be whole and well, and at the same time, to own that we may have things that we can benefit from working on as well. So the communication wouldn't just be, you're wounded, you need to go get help, and I'm fine, right? To say, we all have experienced different things. So for some people, it would rise to the level of what would be called a trauma. For other people, it may not be a trauma, but just stressful circumstances or different attachment dynamics when they were growing up, or ways that we have developed to cope that may not always be healthy. And so I would encourage both for you and your partner to consider mental health support and to consider therapy. Another important piece of the relationship will be around intimacy. So intimacy in a romantic relationship, both verbal and physical, can be very important. And at the same time, it can be connected to a lot of triggers. Some people call triggers awakenings or reminders of traumatic events. And so we want to, again, approach intimacy with care, with patience, and with a lot of communication so that we can understand some of what may be alarming or uncomfortable to a person given their history. And so showing up in the area, intimacy and around physical touch with care and a concern and an attentiveness to the other person's reactions, needs, and desires. So with anyone, you don't want to lose sight of them and just be in a place of being selfish or only focused on yourself. And this is especially the case when we're talking about physical intimacy with a trauma survivor, to really be tuned in and to not fall under the belief that speaking about intimacy will somehow ruin the mood. Instead, being able to talk about what you are wanting to do or the way you're wanting to express yourself with your partner can be very honoring, can actually increase the excitement, and can increase the capacity for intimacy and for pleasure. So helping people to be present with you in part can be as a result of the communication, so that you both stay present instead of being more prone to flashbacks or going to the traumatic memories. With our communication, with eye contact, with presence, we can help people to really be in the moment, which can increase the sense of intimacy and the sense of connection. So as we're thinking about being with a trauma survivor, it's important to know that we are all worthy and deserving of care. But sometimes there are the scripts that can play in people's minds that can make them feel unworthy, that can make them feel unwanted, can make them feel not cared for. And so we want to be very thoughtful in our treatment of each other, that we are communicating in honoring, a care, a prioritizing of each other, right? That we value and care for each other, not only physically, but emotionally, spiritually, socially. So paying attention to your partner, not only when it is just the two of you in an intimate space, but also thinking about them and talking about their comfort level when you're in social settings. Sometimes that may be social settings where people who hurt them in the past are present. For example, if they were hurt by a family member and you, for some reason, are going to a family event, it will be important to have a plan, a way of communicating your comfort, their comfort, and also being tuned into if they need to exit those spaces or the ways in which you can best support them there, not only around family members, but if you live in an environment where they are likely to see someone who harmed them in the past, or going into places or locations where harmful things took place. So we want to think about that intimacy and care when we're in private space, but we also want to think about the intimacy and care that we provide in public spaces and around other people. This will help the trauma survivor to feel safe, to feel comforted, to feel that there is concern for their well-being. It is also important to encourage self-care for the partner, to be intentional about taking good care of themselves, and that they encourage their loved one to do the things that will be nourishing to them. Right. So we mentioned having a therapist in addition to the partnership, but also for the person to have their supports or their friendships. It's important not to isolate a trauma survivor that can replicate or duplicate the actions of abusers who often want to isolate you from other people. So to encourage healthy friendships, if there are family members who are safe for them to be around, to encourage that network and that sense of community can really make a difference. It's also important that in addition to this podcast episode, that you continue to educate yourself about trauma, about the consequences of trauma, but also about the possibilities for healing and for recovery. So the vagus nerve is a part of our nervous system that has particularly been studied for trauma survivors and looking at recovery. And one of the things that we know about the vagus nerve is that deep breath can help a person get to a place of calm within their nervous system, which is why we started the episode with breath. If someone is having a panic attack or is feeling particularly stressed, cold water can also be soothing. So drinking water or putting water on the person going to the bathroom and putting water on their face can also help to kind of ground them in the present moment and to establish that sense of calm. And there is something called co-regulation. So other people, the presence of calm, loving others can help people to feel more settled in their nervous system instead of panicked or distressed. And so we desire to be a calming presence for other people instead of a presence that is triggering or activating. But we can be that for each other. We can show up with care and with love. And even if there are disagreements, thinking about the ways in which we express ourselves so that the care is there, even though the disagreement needs to be discussed and talked through and finding some sort of resolution. It is important for us to be intentional in our observations and in our communication. And it also is important to slow things down when there's a circumstance where your partner may be feeling triggered, or you may be feeling triggered, or both of you may be triggering each other. And in that circumstance, there can be an escalation of tension, which can result in both people feeling alarmed and unsafe. And so, in moments of tension, with our caring communication, to try to slow things down, to slow down our responses, to take, I like to call it sacred pause, so that we can think through what we would like to share or what we would like to happen, what will help us to get toward greater clarity and connection instead of furthering harm or disruption. So us really being mindful and intentional in our pacing so that we can interrupt cycles of escalation, but instead can really be a calming presence and seek to understand, right? To seek to understand what is happening for the other person and to seek to express ourselves in ways that are clear. So as we think about this notion of loving, it's important to know that there can be a lot of healing that takes place in a loving and caring relationship, that there can be another part of the journey where a person has done inner work for themselves, but additional work happens within relationship, within intimacy, and with connection. And so to know that we are worthy of care, of love, of patience, that we are worthy of respect and kindness, and that it is possible to have ruptures or challenges or disappointments, and that not to explode into a place of violence or harm, but that we can work through those moments with care and with love so that it is healing. I'm excited about your journey back home to yourself, and excited about the love that is in your life. I invite your soul to tell your heart, mind, body, and spirit, welcome home.